I'm a psychiatrist. Why I chose psychiatry is itself a funny situation, because actually I did medicine, and when I finished medicine, I have lost touch with the patients, and I was thinking of them more in terms of lung, abscess lung and liver failure and renal issues and things like that, and I was not really connecting with the patients as such, but I was connecting more with their organs. So I thought I would like to connect with the people, and that's why I have chosen medicine. So I shifted over to psychiatry. In fact, when I chose psychiatry and joined psychiatry, my professor in fact called my family and said, why is she doing when she has got an MD general medicine? Why is she choosing psychiatry? People would give their arm for an MD general medicine, and she has chosen psychiatry. But the same people now are appreciating and saying that it's a very good choice that you have made. And I don't regret the choice at all, because psychiatry has given me a different dimension to the medical field. I think it's a field where you combine your medical skills and knowledge, and at the same time you have to be a warm human being who cares about the other person. So it's a perfect blend as far as I am concerned. In the last 30 years as about 32 years as a psychiatrist, I don various hats. I am a private practitioner. I run the Department of Psychiatry in Voluntary Health Services and run a de-addiction center. And in addition, I've started an NGO called SNEHA, which works in suicide prevention. And that has been made possible because of psychiatry. Because psychiatry, particularly if you take up an issue like suicide, many people ask me, why did you want to do work on suicide? So when I was doing psychiatry, I was a little, disappointed with the kind of cures or treatment which I was able to give at that time. I'm talking about 30 years back. We had just a few handful of drugs. Many of them would make the patients drowsy or have extrapyramidal symptoms, and we were not giving the patients a quality of life. And at the same time, I was thinking suicide is something which you can prevent. Why nobody is working on prevention of suicide? So that is how I got interested in suicide prevention. And then when I read about suicide, what the classical textbooks described was completely different from what I was seeing. So the classical textbook description of risk factors of an elderly white male depressed living alone just doesn't gel with the Indian scenario, where it is very impulsive, young women taking pesticides, living with family, quarreling with family. So it was completely different. So I saw in the international conference, I presented a paper on how the suicide in India is much different from what the Western textbook classically described as risk factors for suicide is non-existent in our country. So that was the one which got me interested in suicide prevention, and then I went to a variety of suicide prevention centers in Europe, and I knew that the mental health personnel we have is very limited. For example, we are a population of 1.2 billion, but we have only about 4,000 to 5,000 psychiatrists, so which is a very, very few number. So I like the concept of the Samaritans, where they use lay volunteers to deliver mental health, and I started SNEHA. Now it has been working for the last, in fact next year we are going to celebrate the 30th anniversary, and it is run solely by volunteers, and we are running 24 hours. So what is possible is for us as psychiatrists, it's one thing to be sitting in your clinic, and I'm sure any psychiatrist will have enough patients, because there are so few psychiatrists anyway. I mean, as I said, for 1.2 billion, we have 4,000 to 5,000 psychiatrists, which is completely inadequate when you look at the size of the problem. See, when you look at the size of the problem, we have millions of people in India who suffer from depression, schizophrenia, substance abuse, and a variety of disorders. In fact, a recent research has shown that in a in a general practice, about 20% of the patients have probably depression or anxiety. So that is the magnitude of the problem, and that's the prevalence of the problem. Considering that we have so few psychiatrists, so any psychiatrist who is reasonably good will have definitely a good amount of private practice. That is not an issue. But in our country, what is important is that it is not adequate for psychiatrists to be just in the clinic and treat clients who have mental disorders. I think the stigma attached to psychiatry in our country is diminishing, but it is much more than in other countries. Okay, we still have in this day and age, we have still patients who are in this day and age, we still have patients who are tied, who are taken to temples, who are tied up, and I am sure all of you remember the Yaravadi disaster. So all those things are happening. So first is we have to raise awareness that this is like any other, like nobody is worried about going to a cardiologist or a respiratory disease person. The same way they can go to psychiatrist. And the best thing is, in these 20 years, I think what has 1 minute, I just made it, sorry. Whatever, I have to.
Yeah. We were talking about the SNEHA organization, and
yeah.
So how has the response been for?
See, when I started SNEHA, people were very. I won't even say discouraging, even a little bit beyond that. First they said, at that time it was still Madras, they said Madras was a conservative place, people won't come and talk to you. The second reason is, the reason they said was, you can't run an organization based only on volunteers, it will peter out over a period of time. And the third thing they have is, will suicidal people, will they come and talk to you? Okay, these were the major doubts people had. And there were quite a lot of people who were discouraging me about starting this. But the fact that we are going to complete 30 years next year, and we are running only with volunteers, I am very proud to say that ours is the only organization which has been open 365 days of the year for the last 30 years. We have had tsunamis, we have had Rajiv Gandhi's assassinations, we have had everything, but our center has been open right through, and we have had distress calls. Every day we get about 20 to 30 people who are extremely suicidal. We get about 30% of them are high-risk suicidal people. But our volunteers are extremely well trained, and they are very capable of handling a person who is suicidal. So that is how I started SNEHA, and it is running. The thing is, we have not confined ourselves only to waiting for the callers to come. We have gone out into the community to reach out. For example, after the tsunami, we have taken a place called Srinivasapuram, adopted the place, and we have helped psychological problems of children, adolescents, women, and people who have been bereaved by tsunami. And with the help of WHO, we have, near Kadalur, we have started, because pesticide is a very common method of committing suicide, we have started a new project which is called as a central storage of pesticide, where we construct like a bank locker, and every family can store their pesticides there. And it has been rated as one of the most innovative, cost-effective programs by the Global Mental Health Forum. So it is not, people feel that we do not have the infrastructure to do anything. But it is, but we have enough resources. It is only how we handle the resources which is important. And it is not that once you are in private practice you cannot do research. That used to be the thought before, but not anymore, because most of my research I have done in private practice and in the community. All the research papers, even including the Lancet papers which I have published, have been done in the community. And it is high time the psychiatrists do not think of themselves as, or keep themselves in an ivory tower. I think unless they move into the community and work with the community, the stigma will remain. So only when they start moving into the community, working with the community, and it's not only treating mental disorders. We have to treat positive mental health also. We have to foster positive mental health, because the rapidity of change which is happening now leaves a lot of issues. It is the decade of depression now. So because of this, such a rapid change in our environment, people are going to get more and more stressed out, more and more anxious, and more depressed, and they need more and more mental health professionals. So there is a huge scope for psychiatrists, because in psychiatry you can branch into anything which you want. Child, adolescent, geriatric, psycho-oncology, you have or psychiatric epidemiology. So wherever your interests are, you can branch out and make a name for yourself. So when I, as a small private practitioner with a small NGO, can can become a consultant with the WHO. And in fact, last year the WHO for the first time released the World Suicide Report, and I was the international editor for that. So there is no limit to what you can do, and so you can really serve the community. Okay, you can really serve the community with your not only your medical psychiatric knowledge, but as a person also. So there are so many areas, for example, refugees, youngsters, domestic violence, the internet addiction, so many things which are happening now. And it's all exciting frontiers, which many young people can take up and make a name for themselves. And I can definitely say that because of the dearth of psychiatrists, you will definitely be able to have reasonable amount of finances to keep, to sustain yourself comfortably. You may not earn as much as maybe a cardiothoracic surgeon or anything like that, but definitely you will have the satisfaction of helping a person come through difficulties. See, many of my patients have said, when they have been depressed, and very successful people who have done everything and then they have become depressed. When you really treat and they become all right, most of them say it's like a second life, and you can make a difference to people's life by being a doctor and being yourself also, by being a human being also. So I think it is a fantastic field because it combines everything. It combines social values, it combines your medical skills, it combines your community service ideas, and you can really make a difference not only in people's lives but also in the community's life.
Do you have any extracurricular hobbies other than medicine? Anything else you're passionate about?
Oh, I read a lot. I go for walks. I enjoy my walks. I read a lot. I love good food, so I go to good restaurants. So wherever the conference goes, I'm a vegetarian, but still my friends know me very well. So when they go, my friend like Diego or Alan said, okay, we have checked out the vegetarian restaurant, so we'll go for this. And so I love good food. I love very crime and suspense. I don't read highbrow books. I read very ordinary crime novels, and I enjoy traveling. And because I'm a consultant for WHO, fortunately I've been, fortunately or unfortunately, how do I say, work has taken me to a lot of countries, and I've learned a lot about other people and their civilizations. So
can you tell us something about your experience with WHO?
Yeah, the WHO, as part of the WHO, I have prepared manuals for WHO for what we call as a resource booklet for primary health workers, teachers, general physicians, first line workers like firefighters, and primary health workers, how to recognize and treat depression. We have produced manuals, and I was the author for that. And then because of I've done some training workshops for WHO in Africa, in a few countries in Africa and Southeast Asia and other places. And the most recent thing which I've done is I was editor for the World Suicide Report, which I think is an honor given to me. And there are many people who work without being recognized, but I'm one of the fortunate people whose work has been recognized, because I have been given the Honorary Fellow of the Royal College of Psychiatry, Honorary FRC Psych, which is given only 5 people every year. And I think I was the second Indian to receive it. The previous person to receive it was Professor Wick about 16-17 years ago. And now I got it. Now last year Dr. Tara Abskaf also got it. So we are the only 3 Indians who have been conferred the Honorary Fellow of the Royal College of Psychiatry, which itself is a big honor. And
thank you so much. Thank you for speaking to us. Thank you. Bye.